Good morning, guys. Today we will be presenting on special needs and special issues in dentistry. The group members are as follows: Shanna K. Manning, Carifa Warner, Dominique Francis, Keno Irving. The objectives that we'll cover for this presentation are who are termed as special needs, common mental and physical disabilities, behavioral management strategies that can be used in the dental office, as well as behavioral management strategies that can be used at home. I will now hand over to Keno, who will lead us through the first objective.
Our first objective is to clarify who are termed as special need. And special need patients are those who, due to physical, medical, developmental, emotional, or cognitive conditions, require special consideration when receiving dental treatment. Individuals with special needs are at increased risk for oral disease. However, some dentists feel uncomfortable providing treatment for special needs patients, which results in loss of greatly needed services. Now, let's discuss some of the common mental and physical disabilities seen in patients with special needs. The first is cerebral palsy. Now, what is this? Cerebral palsy is a neurological condition that appears early in life and affects one's body's movements and muscle coordination. It is not a specific disease entity, but a group of disabling disorders which is due to permanent damage to the brain in either perinatal or prenatal periods of life. Now, what are the signs and symptoms? All patients with cerebral palsy have issues with movement and balance. However, the symptoms may differ depending on the severity and type of the condition. They may involve, but are not limited to, muscle weakness, stiffness or paralysis, poor balance, irregular gait, uncoordinated or involuntary movements. The oral conditions that affect individuals with cerebral palsy. These include trauma, periodontal disease, teeth grinding, malocclusion, dental caries, poor hygiene, as well as overbite, which can lead to excessive drooling. Secondly, Down syndrome. Down syndrome is a genetic disorder which is caused when there is an abnormal separation of the chromosomes, thereby resulting in that individual having an extra 21 chromosome. Individuals with Down syndrome have distinct features that help us as clinicians to distinguish them from others. These include a flattened face, a small head, short neck, short stature, and upward slanting eyelids. So oral manifestations of individuals with Down syndrome. These include overbite, fissured lips and tongue, microdontia, oligodontia, and periodontal disease. So individuals with Down syndrome have a high susceptibility to periodontal disease. This is due to local or systemic factors. Some of the local factors being teeth grinding, poor oral hygiene, or tooth morphology, while the systemic factors include genetic influences, poor circulation, and decreased immune response. The next disability we will look to cover is autism spectrum disorder. So autism spectrum disorder is defined as a wide range of conditions that are characterized by how an individual communicates and interacts with the society at large. It is caused by a developmental abnormality of the brain and it can be detected as early as 1 year old. So signs of autism usually appear by age 2 or 3, but it can appear as early as 18 months. These may include a lack of eye contact, repetitive behavior, for example, rocking back and forth or staring or having floppy hands. It can also include drooling, poor coordination, and they do not respond to their name being called. So what does this mean for autistic patients orally? So patients may present with ulcerations, xerostomia, poor oral hygiene, gingival inflammation, and dental caries. Fourth and final disability that we will cover is minimal brain dysfunction. And this is a neurodevelopmental disorder characterized by immaturity involving control of behavior, emotions, the ability to speak, read, or solve problems. It is caused by brain damage, hypocalcemia, or nutritional deficiency. Symptoms of MBD include lack of motor coordination, inability to keep still, inability to communicate, difficulty in performing structured tasks, and finally, visual disturbances. We will now move to treatment of these patients.
Firstly, we'll be looking at the approach to special needs care. Special care dentistry is a branch of dentistry that provides oral care services to people who have physical, medical, developmental, or cognitive conditions that make it difficult for them to receive such care. The Special Care Dentistry Association believes that individuals with special needs oral health has a direct impact on their overall health, and that adequate oral care should be available to all patients with special needs. So now we'll dive into treatments for individuals with cerebral palsy. So due to the difficulties they have regulating and moving their limbs, children with cerebral palsy frequently struggle to complete simple tasks such as brushing their teeth. As a consequence of poor oral hygiene, children with cerebral palsy may have a greater incidence of periodontal disease. So how do we treat periodontal disease in patients faced with cerebral palsy? So in office, we can promote independence with regard to regular oral care. We aim to encourage patients to demonstrate their brushing technique and then make specific suggestions on brushing techniques or toothbrush modifications. Also, as a practitioner, you should engage your patients in practical brushing and flossing demonstrations. Versus at home, where some individuals are unable to brush and floss on their own due to poor physical or mental coordination. So we should discuss oral hygiene with caregivers on a daily basis. Don't assume that all caregivers are familiar with the fundamentals. Show them how to brush and floss properly. Oral hygiene can be made easier with a floss holder or a power toothbrush. Also, when demonstrating sitting or standing positions for the caregiver, concentrate on your previous experiences with each patient. Additionally, stress the importance of having a regular oral hygiene routine. Caregivers should make an effort to employ the same place, time, and positioning. Moving on to malocclusion. Children with cerebral palsy may have weak muscle tone around the mouth, making sucking, chewing, or swallowing difficult. They are more likely to have malocclusion because of this. Sadly, for those with moderate to severe cerebral palsy, fixing malocclusion is practically difficult. Due to the possibility of caries and enamel hypoplasia, orthodontic treatment may not be an option. Nonetheless, receiving orthodontic treatment shouldn't be viewed as being impossible due to the developmental disability in and of itself. So in office, we should educate the caregiver on emergency treatment, since projecting anterior teeth are more likely to be knocked out, broken, or evolves in accidents involving oral trauma. We'll be moving on to dental caries. So as a result of poor dental hygiene, caries is common in people with cerebral palsy. Additional risk factors include food poaching, pharmaceutical side effects, mouth breathing, and medication effects. The treatment at home includes inform patients or their caregivers about medications that include sugar or minimize salivation. Encourage patients to drink plenty of water. Consider sugar-free medications wherever possible and rinse with water after taking any medication. Versus in office, we aim to encourage or recommend preventative measures such as fluoride and sealants. Moving on to the treatment for individuals with Down syndrome. Providing oral care to people with Down syndrome necessitates the adaptation of everyday skills. In fact, the majority of people with mild to moderate Down syndrome can be successfully treated in the general practice. So due to the crowns being smaller and the roots are often small and conical, this leads to tooth loss from periodontal disease. So severe illnesses or prolonged fevers can lead to hypoplasia and hypocalcification. So now diving into the treatment of microdontia. So in office, We should examine a child by his or her first birthday and regularly thereafter to help identify unusual tooth formation and patterns of eruption. Secondly, consider using a panoramic radiograph to determine whether teeth are congenitally missing. Thirdly, maintain primary teeth as long as possible. So we should consider placing space maintainers where teeth are missing. Moving on to periodontal disease. Periodontal disease. So at home, some patients benefit from the daily use of an antimicrobial agent such as chlorhexidine. Recommend an appropriate delivery method based on your patient's abilities. Rinsing, for example, may not work for a person who has swallowing difficulties or one who cannot expectorate. Chlorhexidine applied using a spray bottle or toothbrush is equally efficacious. In office, if use of particular medication has led to gingival hyperplasia, we as practitioners should emphasize the importance of daily oral hygiene and frequent professional cleanings. So periodontal disease is the most significant oral health problem in people with Down syndrome. So we really need to stress these 2 points mentioned at home and in office. Now we'll be moving on to the treatment for individuals with autism. So children with autism should have a readily accessible patient-centered medical home that offers consistent, comprehensive, family-centered, harmonious, sympathetic, and culturally effective care. So just to dive into the general approach towards treatment. So firstly, I'd like to mention that the biggest difficulty in providing dental care to autistic children is their decreased capacity for social interaction and communication. So peevishness and strange vocalizations can result from a variety of issues such as the inability to control their emotions, or whether it be repetitive bodily movements or hyperactivity linked to attention deficit disorder and a low threshold for irritation. So in office, we can encourage pre-visit meetings. So they are beneficial for both the parents and the dental team because they help families to get ready for their first dental appointment. The pre-visit meeting will assist the parents in preparing the child for dental care, and it is advisable to discuss any hesitant issues with child behavior. Now I'll be handing over to Karifa, who will take us through the third objective.
The next objective that we're going to go into is behavioral management strategies that can be used in the dental office. So behavioral management in the dental space is important in the treatment process of dental complications. Effective management will ensure a controlled and non-chaotic environment, which makes treatment easier. If the patient's behavior in the dental office cannot be managed, then it will be difficult, if not impossible, to carry out any dental care that will be needed. The fundamentals of behavioral management center on the attitudes and integrity of the entire dental team. For a patient with special needs, the dentist will be required to change the regular approach to dental care in order to effectively treat this patient. Guidance of basic behavior includes employing techniques like distraction, desensitization, positive pre-visit imagery, direct observation, tell, show, do, ask, tell, ask, nonverbal communication, positive reinforcement, and descriptive praise. Distraction in the dental office is a method recommended to help alleviate dental anxiety in a patient with special needs. So using a fidget spinner or playing music can help to reduce dental anxiety and keep the patient calm during treatment procedures. So in the dental setting, the patient is desensitized to tell, show, do. So the patient will be told about what kind of procedure they will be doing, and it will also be demonstrated. After which, when the dentist does said procedure, the patient will feel less intimidated and in some way would already be prepared, so it would be less threatening and treatment would be easier. So the positive pre-visit imagery is an approach where the patient will be allowed to view a positive photograph or image of the oral health team and the dental operative environment while they're at the waiting area. And this is a form of psychological preparation. And then we have direct observation, which is similar to the tell, show, do, but rather than explaining the dental procedure verbally, the patient will be allowed to directly observe the kind of treatment that they will be receiving. Then we have the positive reinforcements and descriptive praise, where dental professionals are constantly praising and giving words of encouragement to the patient so that they feel happy and that they are positive during the procedure, which will also help them to remain calm. Okay, so now I would like to share with you all a video of a special needs patient. She has cerebral palsy and she needed some dental work to be done. And so this video is just going to depict how her treatment went and what they had to go through to get it.
Cassandra is a cerebral palsy patient. Anytime that I would call her for a dental appointment, I would express to them that you got to take special care with dealing with her. When I say that, then they're, well, we're not really trained to deal with her. We're sorry, we can't help you. We've always fallen through cracks with most of the things that I have tried to get for Cassandra, so it was like this too was just part of how we live. Mm-hmm. And I knew with everything I did, I was gonna have to fight. So I fought. And I don't believe in giving up. Never give up. That's when I got introduced to the new program.
There's probably about 500,000 disabled people in the St. Louis area, and there's almost no place for them to go to get dental care, and especially under Medicaid. And these patients can't be seen in a normal dental setting. The dentists are not trained to see the patients, and we're addressing that here at AT Still to try and get our students to be exposed to them and be able to take this into their own practices later on.
When I heard about the program, I said, oh, like the heavens had opened up. Hallelujah. Yes, thank you. That had to be the best news I ever had. I was so happy that somebody finally cared enough.
So Cassandra was seen here at ATSU in the special needs clinic, but she wouldn't let us into her mouth to take x-rays or to treat the problems. So we do the work at Barnes Jewish Hospital in the operating room. That's where I saw Cassandra, and once we got her fully under sedation, we were able to see the extent of her problems. Cassandra needed 13 extractions and 9 fillings. It's quite a bit of work to do all at once, but that's the blessing of this union of all of these people coming together. Washington University School of Medicine provides the anesthesiologists. Barnes Jewish Hospital provides the OR. Affinia provides the patients, and ATSU provides the surgeons. These patients deserve dignity and respect, and I think this is one way to give that to them, that they can be on the same level in dental care and medical care as everyone else.
The next day, early that morning, he called. He said, well, Miss House Cassandra. I said, she's wonderful. He said, has she had any problems in it? No. You did a wonderful job.
Okay, so that was the video, and I am very happy that Cassandra was able to get the dental treatment that she needed in the end. And this is why, as dental care professionals, it is important that we include management of patients with special needs into our practice, because into our practice because patients with special needs are important too, and they also require proper dental treatment just as any other normal person. So whether they have autism, cerebral palsy, they deserve to get the best treatment possible. I'll now hand over to Dominic, who will take us through the additional considerations for dental patients with anxiety or special healthcare needs.
Now we'll be looking at some additional considerations for dental patients with anxiety or special healthcare needs. So the first one is sensory adapted dental environments. The sensory adapted dental environment intervention includes adaptations of the clinical setting. Example, dimmed lighting, moving projections such as fish or bubbles on the ceiling, soothing background music, application of a wrap or blanket around the child to provide deep pressure input to produce a calming effect. Indications: used with patients with autism spectrum disorder, sensory processing difficulties, other disabilities, or dental anxiety. And here's a short video explaining the sensory adapted dental environment intervention.
Dr. Jose Polito at Children's Hospital Los Angeles has been 12-year-old Jack Geary's dentist for the last 6 years.
Did you pick the bubbles this time?
Jack and his mom, Carrie, are now part of a USC research study that hopes to change a typically scary dental experience for kids with autism into a happy one.
Being part of this project has been a gift. Going to the dentist is tough enough for an adult, and having a child who can't navigate our world makes it 10 times worse.
First thing you do is turn off the lights.
Lucia Florendez, a PhD student with USC's Science and Occupational Therapy Division, shows me how this dental exam room is different. There are blackout curtains on the window. Classical music is played through an iPod. Overhead, a projector displays a kaleidoscope of colors and other images.
There's a Nemo hidden somewhere in there.
The dental chair is outfitted in comfortable straps resembling butterfly wings.
I think I like this part.
You like the butterfly blanket that gives you a hug?
Yeah.
Each visit and reaction is recorded and analyzed.
The idea is that more and more children will have good preventive care to minimize, the times that they need to be in a hospital environment.
He's comfortable and he's not fighting me to come in. He's not afraid. It's been amazing.
So based on this video, we can see the different behavioral management techniques employed by the dentist in this video. So first we saw where they dim the lights to prevent sensory overload because this patient does have autism. And also we saw them using the technique of distraction where they use the kaleidoscope to show the different colors of the fishes and Nemo and all of that. And also they were playing some classical music. And also by the way that they describe the dental equipment. For example, instead of using the term papoose board, they call it the butterfly blanket, which gave him a hug. And this, of course, made treatment easier. We can see where the patient remained calm throughout the dental procedure.
Our second consideration is animal-assisted therapy. It is a goal-oriented intervention which utilizes a trained animal in a healthcare setting to improve interactions or decrease a patient's anxiety, pain, or distress. The animal, which is available for companionship during the dental visit, can help break communication barriers and enable the patient to establish a safe and comforting relationship, thereby reducing treatment-related stress.
A dental practice in Tennessee has found the perfect solution to this problem. I want you to meet Milo, the newest member of the East Nashville Pediatric Dentistry. There he is, coming in on his throne. Milo is a therapy dog who comes and sits with young patients while they have their teeth cleaned.
So cute.
I love the dog, and it's so cute. I want to hold it. He makes me feel warm.
I didn't know about it. Do you want a dog sitting in your lap today? And I was like, yeah, I'd love that.
And the final objective is effective behavioral management that can be used at home. So the parent or guardian are initially responsible for establishing good oral hygiene in the home. Home dental care should begin in infancy. So the dentist should teach the parent to gently cleanse the incisors daily with a soft cloth or an infant toothbrush. For older patients who are unwilling or physically unable to cooperate, the dentist should teach the parent or guardian to clean the teeth twice a day using correct toothbrushing techniques and safely immobilizing them when necessary. Daily home preventative dental care may have to be tailored to meet the specific needs of these patients, such as the use of dental aids. Demonstrate model behavior to maintain positive influence. Be receptive to positive behavior and offer praise. Build a consistent approach to consequences and reward, and regular follow-up supervision at home and in the dental office is essential for effective implementation of the preventive dental treatment plan. And here are some dental aids that can be used at home. So we have the electric toothbrushes, modified toothbrushes, and super brush. And this concludes our presentation. Thank you guys for listening.